So good morning, everybody. Thanks for joining our virtual Walk with the Future Doc. Sorry about the little delay this morning. But my name is Lauren, and I am a fourth-year medical student at WVU. And hopefully in the coming weeks, we'll be able to get back to walking in person up in Morgantown and having like the virtual as well, being an option. So to start, we always make a few announcements. Everyone should have received a pop-up notification through the Zoom app. And that is just to consent to the audio recording of the walk. And only the audio portion of the walk will be made available publicly on our YouTube channel, which is WVU Walk with the Future Doc. We also have a lot of our previous walks posted on our YouTube page as well, kind of like a podcast format. So if you wanted to like go for a walk and listen to one of our old our old discussions and walks on YouTube as you're walking, that could be an idea. And then also our Facebook page is WVU Walk with the Future Doc as well. And we always post updates about our future walks on this page as well. So today we have Dr. Phillips leading the conversation about this week's topic of connecting the dots, positive thoughts, and social engagement for success and well-being. And then as we walk together virtually, we'll open the conversation for any questions or discussion that comes up around this topic. So now I'd like to introduce everyone to Dr. Phillips. She's an assistant professor at WVU School of Medicine and board certified family medicine physician. And she's also a certified culinary medicine specialist. So we're really excited to have Dr. Phillips joining us this morning. She's been on a lot of our previous walks, but we're excited to have her leading the conversation. So I will let her begin.
Good morning, everybody, from Sugar Hollow Park in Bristol, Virginia. Out here celebrating my father-in-law's birthday, which actually factored. So back in December, I got board certified in lifestyle medicine. And in the culinary and lifestyle track, we talk about 4 of the basic pillars of lifestyle medicine, which is nutrition, activity, and stress management. I don't think, certainly not in the track, and I don't think as much in general, is another pillar of lifestyle medicine, which is actually positive psychology and social connectedness. And yes, that is actually one pillar because of how closely the two are intertwined. So what is positive psychology? Well, positive psychology is, by definition, the study of that which allows individuals and communities to thrive. It does not minimize misery or any sort of a negative emotional states, but instead focuses on amplifying well-being. And it does so through positive affect, engagement, and focusing on strengths, building good, and that means within a person and also within communities, and also taking communities and people from average to great. So what is the positive affect that I meant? Well, it's an experience of pleasure, particularly pleasurable emotions. And that comes from environmental engagement, happiness in the past, and hope for the future. So focusing on past, present, and future. So there are 5 major pillars for positive psychology, and they fall into the acronym PERMA. So P in PERMA stands for positive emotion, which is the ability to be optimistic and also to view the past and the present positively. So that doesn't mean negating any negative experiences that you might have had, but it does mean trying to focus more on the positive or pleasurable parts of your past and your present and shifting your focus. E is engagement, which is being absorbed in the present in a way that stretches your intellect, your skill, and your emotional capability. R stands for relationship, which is positive social connections, like I mentioned, social connectedness and positive psychology are intimately intertwined. And then M is meaning, or a sense of purpose. And that purpose, I mean, it certainly could be your career if you're doing something that you love, but a lot of times it means a purpose outside of what you're doing for work. You know, what makes you get up every day? What is it that inspires you to keep living? And then A is accomplishments. And that factors in your ambition and accomplishment of realistic goals. So I know we've talked in the past about SMART goals, and part of the SMART goals, the R, is realistic. Well, that doesn't just factor into changing your eating habits or weight loss. It factors into the goals that you set for yourself in terms of your own purpose. So you can see that the pillars are pretty strongly intertwined. So what are some habits that we can try to get into to build on positive psychology and social connectedness? Well, we want to try and find our signature strengths and improve upon them. And this is something that we actually do pretty much first thing with all of our brand new track students. We set them up with what's called the VIA character survey. And what that does is it gives you a list of, I think it's 35 character strengths, and it helps to rank what you are strongest in. So you know what you do well, and you know that if there's a character strength that you want to work on, you know which one it is. And that's available on the website viacharacter.org. Now, of course, you don't necessarily need a test to tell you your character strengths. I'm sure some people could pick out 2, 3, or 4 by themselves, but it can be a helpful tool, particularly for people who are in a more difficult place, who are having trouble seeing the positive side of life, and in particular, seeing the positive side of themselves. Unfortunately, I've been there, so I can understand how people might need a character survey to try and help them establish some of their strengths. One thing that psychologists focus on a lot is counting your blessings or focusing on gratitude. So being aware of the good things in life that you are grateful for. And you know, most of us, if 9 good things happen in a day and 1 bad thing happens, we tend to focus on the bad thing, right? So by actually taking some time to write it down or to sit and think about it, you can help to shift your focus back in a positive direction. And then kind of going off of that, another habit that you can start improving upon is expressing appreciation. So, you know, you've thought about or written the things that you're grateful for. Well, if there are people who are contributing to the things that you're grateful for, expressing that appreciation, which is positive emotion, is going to be helpful not only for you, but for them. And then kind of stemming off of that, regularly performing acts of kindness. Unfortunately, you know, that's something that we've gotten a little bit away from as we've been more socially isolated. So I think as we return to a normal or a new normal, that's one way to help promote your own positive nature, even if it's just a compliment or being helpful and holding a door for somebody who needs it. Those positive random acts of kindness are helpful not only for the person that you're performing them for, but for yourself. One other thing that probably people on the older side think about a little bit more, but I think most of us need to think about more, is writing down how we want to be remembered. And the reason for that is generally you don't want to be remembered in a negative way. So by writing down how you want to be remembered, you can inspire yourself to think about your positive traits. what's good about you. And then that helps you shift your focus again and celebrate the positivity. You want to also do activities that feel meaningful. And again, that goes back to our sense of purpose. So, some people are going to give to charity. Some people are going to, volunteer. But whatever feels meaningful to you, that's what you want to try and focus on. So, talking about all of this and talking about pleasure, there's a differentiation that I want to make. So I'm sure that most people have heard the word hedonia or hedonistic. And generally that has kind of a negative connotation to it. And the reason for that is, yes, it does focus on maximizing your happiness and pleasure, but it does so at the expense of any negative emotions. And it's generally in the pursuit of satisfying your desires. So that tends to be why it has a negative connotation to it. So rather than focusing on hedonia, what we actually want to focus on is eudemonia. And I know that sounds kind of funny, but it stems from the word daemon. And what it means is realizing your daemon, which is your true nature. So it is a pursuit of pleasure, but it's not at the expense of any negative emotions, and it's more goal directed. So it's more about finding your own meaning. So you can see the major difference between hedonia and eudemonia. So, what's the purpose of thinking about this? Why start talking about all this, touchy-feely stuff? Well, there's actually been some research into that. And a lot of it focuses on that sense of purpose that I talked about. So there have been several studies that have shown a reduction in mortality among elderly people in the community with a hazard ratio of 0.6. Well, what does that mean? It means that elderly people who have a sense of purpose, who feel a sense of purpose, they tend to have 60% mortality rate compared to peers who don't share a purpose. So that's pretty huge. Other big things that these studies have shown, slower cognitive decline and a decreased risk of Alzheimer's disease, and even lower inflammatory markers. So inflammatory markers such as C-reactive protein, which a lot of us are familiar with because it's a common marker that's used to look for diseases that are more pro-inflammatory and also risk of heart disease. And then IL-6, which is another cytokine that is pro-inflammatory. That one's probably gotten a little more attention lately because of its role in COVID. And then another thing is that people who share a sense of purpose tend to have quicker recovery from stressful events. So that's mentally stressful events as well as physically stressful events. And then eudemonia itself has a positive association with gray matter volume in the brain. So kind of goes along with the slower cognitive decline that I mentioned, because one of the factors that you see in elderly people who have dementia, particularly Alzheimer's dementia, is less gray matter and less white matter in the brain, kind of a shrinking of the brain. And interestingly enough, eudemonia also downregulates genes that are pro-inflammatory, so create those inflammatory markers, and upregulates antibody synthesis genes. So if you have that pursuit of joy that's goal-oriented, that sense of purpose, that sense of meaning, you actually have a greater likelihood of a stronger immune system. Now, I mentioned that social connectedness is intimately intertwined with this, and there's been some research into that as well, and how that improves your physical health. And what they've noted is it actually activates your parasympathetic nervous system, that rest and digest. So not only are you less likely to respond to something stressful with that fight or flight response, but you're also more likely to be able to temper that kind of response, calm it down, and reduce the inflammation that can go along with it. And this was shown in a cohort study, one of the longest that I've seen, a 75-year cohort study out of Harvard, where they looked at 268 male Harvard grads, which graduated between 1939 and 1944, as well as 456 men from inner city Boston. And they found that the single most important predictor of happiness and longevity is having strong social connections. Now, part of the description of my topic was talking about blue zones. And the reason for that is blue zones are, the blue zone study is a major study that actually shows proof of this. So for people who don't know, what are blue zones? Well, blue zones are areas that have not only a high count of people over the age of 100, but also large clusters of people who have grown old without the diseases that we've gotten used to as being diseases of the elderly, such as heart disease, obesity, cancer, and diabetes. So the initial blue zone study found 5 places around the world that met their criteria for a high concentration of people over 100 and clusters of people who have grown old without those diseases. And those 5 areas were Okinawa, Japan. It's probably one that most people think about because that's been well reported as having a lot of older people there. Ikaria, Greece, which is a region of northern Greece. And then the Oligostra region in Sardinia, which is an Italian island in the Mediterranean Sea. The Nicoya Peninsula in Costa Rica, and Loma Linda, California. Now, why Loma Linda, California, when the rest of the US is kind of going in the opposite direction? Well, Loma Linda has a very high concentration of Seventh-day Adventists. So they follow a specific diet, activity plan, and they are also very strongly socially connected. And that is a common feature with all of these. So a lot of these areas are known for having diets that help them live a long time. And in fact, there was a recent reissue of a National Geographic magazine that focused on the diets of blue zone areas and what kind of tips you can take from that. But it's not just diet and it's not just activity. What they found these 5 places had in common are what they called the Power 9. And yes, there are diet and activity related factors in that Power 9. So move naturally, the 80% rule, or harahachi-bu, as it's known in Japan. Correct. If anybody speaks Japanese and I mispronounce that, please feel free to correct me. Plant slant, so focusing more on plant-based foods and minimizing meat and dairy consumption. And then wine at 5. Most of these communities drink a small or moderate amount of alcohol regularly. But if you think about it, that probably also factors into social connectedness because most likely people are not drinking alone. But 5 of them, 5, actually factor into the positive psychology and social connectedness that I talked about. Purpose is the big one. You'll find that people in all 5 of these areas have a purpose that keeps them going beyond just their working years. downshift, taking time away from the hustle and bustle of everyday life. And that helps with focusing on the positives within yourself, as well as regulating some of that stress that can push us in the other direction. Finding your right tribe. So finding that group of people that are like-minded and that are going to push you in that positive direction. They're going to support healthy habits. They're going to help you remember the good times, and they're going to tell you good things about yourself. Community. Now, what they found with community is that the communities were usually faith-based, but any sort of community that you feel a sense of belonging to, that gives you a sense of meaning, a sense of purpose, that factors in. And then loved ones first. So focusing on your family, your friends, paying attention to your children and helping them grow and thrive. And as I go through some of the habits of these blue zone areas, you'll see these come into play. So some of the things in Icaria, Greece, that help factor into their longevity. They eat slowly and they tend to eat with family and friends. So there's that social connectedness aspect. They take naps, they take time to slow down, indulge in something pleasurable, and it helps their physical and mental health. And then one thing they found is that approximately 80% of Icarian men between the ages of 65 and 85 are still having sex. So that one kind of came as a shock to me, but it does also factor in that loved ones first aspect of the big nine. In Sardinia, something similar. You see fewer people retiring because they participate in activities that give them that sense of purpose. And you'll find when people ask Sardinians about their longevity, they'll talk about diet, they'll talk about activity, they'll talk about wine, they'll also talk about making love every Sunday. So again, that loved ones first, and also indulging in some pleasurable activities. In Japan, they actually have a moai, which is a group of 5 people that are committed to each other for life. And in that article that I referenced, the woman that they profiled from Okinawa mentioned that after her husband passed away, it was her moai that really gave her a reason to keep going. And she did, and now she's over 100. Seventh-day Adventists, obviously, faith is going to be a very strong part of that. A lot of things are centered on faith-based services and what they're finding in the Bible. And they take time to connect with one another, not only for spending time with one another, but things like Bible study and doing things that confirm and improve and build upon their faith. And then in Costa Rica, they have very strong social connections, regardless of what happens that might be negative to them. They'll still get dressed up in bright clothing and greet everybody with blessings to you all. And they also have a very strong faith that brings them together. So some very strong evidence, particularly in blue zone areas, for positive psychology and social connectedness. And it's so strong that there are cities around the world, and several within the United States, that have started utilizing some of these ideas to redesign their cities, their downtown areas, to keep everything socially connected and to allow you a smaller radius to be able to participate in all of those things that help keep you positive, help keep that social connectedness. Fort Worth, Texas is one of the originals in the United States. They significantly rehabbed their downtown, their main strip. And they've seen a major change in stress-based illnesses, chronic disease, and just how socially interactive people are ever since they changed that. So yeah, that's the major bulk of my topic. So if you have any questions, please feel free to ask.
Sure. Well, thanks so much, Dr. Phillips, for joining us on this cold Saturday morning and leading the conversation for all of us. Thank you, everyone, for joining us. If you're a new face, welcome to our Walk with a Future Doc program. My name's Mia, and I'm a third-year medical student at WVU. So thanks for joining us. So for the next half hour, 25 minutes, we're going to open it up to questions. You can submit them in the chat. You can submit them directly to me. And again, my name is Mia, or you can submit them to everyone and I'll make sure that they're read out loud. Or you can go ahead and unmute yourself and ask your question if you'd like. Also, just to note, this audio portion of this walk is going to be recorded. So Dr. Phillips, thank you so much for talking about this topic. I think it really resonates with me because I just came off my neurology clerkship. And so when people come in with like their loved ones thinking about like maybe they have dementia or some sort of like Parkinsonism, we ask them about their like symptoms, but like at the end of the conversation, we always ask them like, what is their purpose in life? Which I think is so important because you're dealing with these new symptoms going on and they're kind of stressful, but it's so important for them to remember their purpose. And for a lot of people, it's like their church groups, it's their family, their grandkids. And when they talk about that, like their face lights up. So I really love to hear what you had to say. And there's like research that backs that up because I truly saw it in the clinic. Like people love to talk about their purpose in life when you get them to do so.
And I'm really glad to hear that neurology is starting to do that.
Yeah. So that just made me like immediately think of that. So I'm glad this was the topic today. And so for people who like have trouble remembering their purpose, maybe someone who's older, what can their loved ones do to remind them of their purpose? Do you have any ideas or thoughts on that as a physician?
Well, I think that's where social connectedness is going to play a huge role. So being those people who surround that person, who remind them of the good things in life, who are able to tell stories of the fun things that they've gone through, and possibly even go with them to a faith-based group or to a volunteer project and just help them recapture that sense of purpose. So there's a number of things that people can do, from just telling stories, positive stories about their childhood, things that they remember, things that they love about that person, expressing their gratitude. And that helps the person who's forgetting, kind of count their blessings. And then also just being the person to go with them, being the person to help them stay engaged in their social communities. I think that's another important part.
Okay, good. I think those are, really good ideas, just like being for them. And I think maybe even just like if you can't be there in person, just on the phone, I think phone calls are like super important to people, especially when they live all on their own. And yesterday we had a lecture about like how the beginning of the COVID pandemic affected people when we didn't know what was going on, and especially the nursing homes. It was so different. You had to go visit your loved ones through the window, or like you couldn't see them for a long time because we just didn't know at the beginning of the pandemic like what we could or couldn't do.
Exactly.
So I don't know if you have any experiences to share about that, going to nursing homes, or any of your colleagues going there that you could share about like reminding people of their purpose and kind of how we got through that.
I don't personally have experience with that, but I do know, based on people who work in nursing homes and then a lot of the things that I read, that social activity directors actually became hugely important during the early parts of COVID, because people still needed to maintain that sense of purpose. People still needed to maintain that reason to get out of bed. And when all you're doing is sitting around being lonely, there's really not that reason. So social activity directors had to really get creative and figure out some good independent or socially distanced activities that helped to keep people engaged and give them that sense of purpose, that reason to get up in the morning, help them continue to experience those positive emotions. You know, PERMA, like we talked about, the positive emotions, the engagement, the relationships, you know, being able to talk to people on the phone and also engage with that social activity director regularly, having that sort of a relationship, sense of purpose, and then still being able to accomplish something. So obviously that's one way where the social activity directors had to get really creative, but a lot of them stepped up to the challenge. And I think the nursing homes that had some of the better outcomes probably had some better social activity directors to help out.
Yeah, I think I remember seeing from the lecture yesterday, they were playing bingo, and they had to make huge bingo cards and let the patients like come out in the hallway to like see each other but be distant.
Right.
And they had to hold up huge bingo cards. So just like they were trying every way possible to keep everyone like engaged and active and like excited, looking forward to bingo every week, just to keep their wellness well and their purpose too. But it was definitely hard. And so I commend all like the healthcare workers out there for doing that and being creative with all the things that they had to.
Yeah, and I think that's part of the reason that we saw the rise of not just in older homes, but within work communities, health communities, the rise of increased number of activity classes being able to do over Zoom, because then you can still get some of that social connectedness. You can still see people, you can still engage with people, and then also still have the ability to be active within your own home.
Right. So that leads to our, oh, sorry, keep going. But I have a question that kind of follows up on that.
That's fine. I was just going to say there's been a lot of more Zoom-based stress management programs as well. So that's the only thing I was going to say.
Yeah, so Ashley had a question that she just sent in the chat, and she wanted to know, like, according to the Blue Zone criteria, is social activity and support just as effective if it's virtual?
I haven't actually looked into the research on that. I think it's probably too early on to see anything published, but that is something that I'll keep an eye out for. Knowing what I know about social media research, I'm gonna say it's probably not quite as effective, but I think, depending on the pattern, depending on the way that you're using it, it still does have some efficacy, just not the same as if you're attending those classes or sessions in person. Because I'm sure we've all seen with Zoom the awkward, I don't know if I can talk. I don't know if I'm going to interrupt somebody, because we don't have those nonverbal cues as much. I know that's one thing that my CLG class last year got a little discombobulated about, and that we've experienced at some point this year when we've had our hybrid sessions. So, there is that bit of awkwardness that's going to take away from some of the experience, but you still are able to engage with people, see people, talk to them, and still do some sort of positive activity.
Yeah, which I see the awkwardness here too, as I like interrupt you as you're talking. So
again, the nonverbal cues.
Exactly. And so the thing I love about our virtual walks is that I do miss being together in person, but the amount of people that we're able to reach in different parts of the country and even parts of the world has been pretty cool.
Absolutely.
So there's pros and cons of going virtual. So as we continue our walks, we're definitely going to continue keeping them virtual, but we're hoping to meet up in person as well. So
that way we can get the best of both worlds.
Yes, we're going to try. We're going to try. I do have a few more questions in the chat. We have another question about blue zones, since we're on that topic. So are those areas more financially stable?
The answer is no. Actually, most of these places have been, up until recently, other than Loma Linda, because that's in the middle of California, But up until recently, most of these places have actually been quite isolated. And a lot of them have seen increased incidences of chronic disease ever since, Western influence kind of snuck its way in there and they got a little bit more connected. But the way that they maintain their blue zone status is they still follow a lot of the traditional ways. So they still maintain that social connectedness. They still cook in the same way. They still try to maintain their activity levels. They haven't fully subscribed to convenience culture that Western society glorifies. And that's how they're able to sort of maintain it. But I think losing the social connectedness is probably what's going to cause them to lose the blue zone status if that ever happens. But yeah, most of these places are actually very isolated, relatively poor, but very strongly connected, strong sense of community, a strong sense of social connectedness. And everybody in the community seems to have a strong sense of purpose. And people in the community support that. So yeah, interestingly, that's not the case. Now, I think the places that are starting to rehab a little bit and that are starting to focus more on blue zones, I think those people or those areas are probably a little bit more financially stable. But the classic 5, no.
Yeah, Dr. Phillips, thanks for the talk. And I was actually going to follow up on that kind of concept. I read the Blue Zones book, and it is really, really awesome. So I definitely recommend everyone check it out. But I guess my question kind of stems from whenever I read the book, a common theme, like you said, there wasn't any type of really financial stability that these areas had. They were largely rural agricultural areas, and I actually spent pretty extensive time in Costa Rica, not necessarily in the Nicoyan Peninsula, but the area that I visited the Nicoyan Peninsula, and the area that I was actually in, there were a lot of similarities. They have that saying Pura Vida, and it's very just this laissez-faire style of life where there's just not really any worries. They're happy with what they have. They have their basic needs met. But my question is, there's pros and cons with that. And as we enter, I guess, particularly us, and I mean, you're already there, this, what I would consider kind of like a high stress occupation. It's like, how do you balance meeting all of those, what I see as kind of an essential factor to reach that kind of, I guess, just quality of life of having time to be with your community and having time to, even find your passion or work on your passion, when it seems like, I mean, right now as a first year medical student, I feel like school is just all encompassing. So I don't really feel like I have time to even do anything else other than school. So it's just kind of an interesting dynamic that I see where these 5 areas that are blue zones, from what I remember being like the time that they had to spend with their loved ones and to spend on their hobbies, like that seemed to be a common denominator. And then at least in my current life, I don't feel like I have time. So it's just kind of an interesting thing that I've seen.
So I'll admit, if you'd asked me 5 years ago, I would not have been able to answer that question. But a lot's changed since then. And for me, a big part of that actually has been support. Not just social support, finding best friend that I've had in a long time, but also support within my career. So, finding those mentors that are able to be part of my tribe and provide me the support that I need, whether it's, actual time, like my chair currently, or even if it's just strategies. By finding those mentors that are part of my tribe, it's given me the ability to explore what my passion is. And that's what's helped to drive me in the direction of doing culinary and lifestyle medicine. Because I've loved cooking since I was 4. I got into primary care because I wanted that relationship, but I also wanted to help prevent disease. And that's not really the way primary care is anymore. So how do I find my purpose in that sort of area? And like I said, a lot of that's been the mentors, the tribe that I found. And the other part has been counting my blessings and, participating in gratitude and performing random acts of kindness, because that really doesn't take a lot of time. And that actually does help to build relationships, because when you're able to be positive, it draws more people to you. And when you're performing acts of kindness, it kind of solidifies that relationship. And like I said, it doesn't take that long. But I think the big thing that kind of got me through knowing, sorry, I think I dropped off there for a second. Finding my sense of purpose, knowing what I want to do and that I need to work hard to get there. And that sense of purpose really does help to drive through a lot of the negative parts of medical school, of residency, the stressors and burnout that you can get in your career. But that took some therapy. It took some soul searching, and it took time to figure that out. But I will say that VIA character study that we've been doing with our track students actually has helped, because then I know what my strengths are in terms of my character, and I can build on that. And that was kind of what helped to jumpstart the whole thing.
Hi, Dr. Phillips, I have a follow-up question I'd like to ask about that.
Sure.
So you've talked so much about the importance of having like a positive mindset and having good social connections and doing things you enjoy and finding your purpose, and how crucial all of these things are to being healthy. But I was wondering what you thought about perhaps improving your diet or becoming more active first, and then improving your mindset occurring naturally as a downstream effect of that. Because as I've talked about on here before, I used to have a really bad diet, and at that time I was a pessimistic, cynical doomer, and now I'm just a much happier person, a much more cheerful person. And I think it's because I changed my diet, and that was the first thing I did. And so I was wondering what you thought, whether your clinical experience or what you've seen in the research about how improving your diet can cause you to improve your mindset and maybe make more social connections and things like that.
Absolutely. So one of the main points of the article that I mentioned, that Blue Zones article in National Geographic, is a lot of things are cooked from scratch, and there's a ritual in it. And so that's one place where having food that's not convenience food is going to be helpful, because it actually does give you the time to get in that positive mindset as you're preparing it, as you're working it, as you're cooking it. And then it actually makes eating it a little bit more of a ritual, because you put so much work into it, even if it's just half an hour. But you put the work into it and you enjoy it more. So everything becomes a little bit more of a ritual. And so that really helps with the positive mindset. But also, it helps to, there's a lot of research that shows that heavily processed foods tend to be more pro-inflammatory. You have your heavily processed carbohydrates, your heavily processed fats, your body's not really used to working with. And so it does tend to bring out the more inflammatory side, which is going to activate your sympathetic nervous system, that fight or flight part, and get away from that parasympathetic nervous system like we talked about. But there's also strong research that whole food diet helps to improve psychology, especially if you're getting a good amount of either plant or animal-based protein, good quality, because that actually helps to build the neurotransmitters that can be decreased in depression and anxiety. And then exercise is very strongly linked to positivity, because exercise helps to activate the dopamine system, that pleasure system in our brain. It's where we get that runner's high that people talk about. It's the dopamine activation. And so exercise has definitely been strongly linked to improvements in depression, anxiety, and similar parts within bipolar, helping to kind of calm those down a little bit. And speaking from experience, being more active definitely is helpful for my mental health. I noticed that when I started doing a lot more resistance training, particularly high intensity resistance training, where it actually gets my heart rate up in addition to helping me to build muscle, my anxiety significantly improved, and I was able to get off of one of the medications that I was on for anxiety just by doing that. But I've definitely also noticed an improvement in my mental health since going more whole food based. So yes, and the research in that chapter in my textbook for lifestyle medicine, the first 2 parts are on diet and activity and their effect on stress management and mental health. But we talk so much about it, and we've talked so much about that on Walk with the Doc, that I wanted to focus on something else. But yes, you're absolutely right that those do have an impact. They're definitely interconnected, and that's why they're part of the big 9 as well.
Thank you.
You're welcome.
Yeah, thanks for bringing that up, Michael. I really do think those 2 things go hand in hand. Ashley said she took a whole class in college on the positive neurological and psychological benefits of aerobic exercise. And for me, something that I do is like, sometimes I'll go for a run and I just listen to like music that I can kind of sing to, nothing like too hardcore, or I'll just go for a walk and like count my blessings. So if you are somebody who doesn't like to run and get the runner's high, but you like to walk, just taking a walk, like without music or listening to a podcast that can help you reflect on things. That's how we can like pair this positive psychology with exercise, which I think can kind of maybe multiply your benefits.
Absolutely. Either way, you're still getting that dopamine expression through the activity, and that's just going to help solidify any sort of positive psychology habits that you're trying to do while you're exercising.
Yeah. Absolutely. Well, I think we're going to start to wrap up this talk here, and we've got about 5 minutes left. And again, Dr. Phillips, I want to thank you so much for leading this conversation today. We really appreciate you being here and bearing through the cold with us. As I ask you to wrap up this talk, I'm going to ask our participants to open up the chat and type, if you're comfortable, who you are and where you're working from. We love to see how far this program is reaching. And Taylor also posted a link to one of our surveys. We really appreciate you filling that out after this walk and letting us know what you thought of the walk, how you received the topic, and just kind of give us some feedback on what you'd like to hear in the future. So we'd love to hear what you have to say. And again, thank you all so much for joining us. Dr. Phillips, can I ask you to wrap up with just like maybe 3 major points that you'd like someone to take away from this talk today?
Well, I think the major points that I want everybody to take away is actually the pillars of positive psychology, the PERMA, since everything else factors into that. So just as a reminder, PERMA stands for positive emotion, which is the ability to be optimistic and view the past and present in a positive way. Engagement, so being able to be absorbed in the present in a way that stretches your intellect, your skill, and your emotional capability. Your relationships, your positive social connections, your meaning or purpose, and your accomplishments of realistic goals.
That's awesome. Thank you, Dr. Phillips. And any final words?
I think just keep in mind that stress management, sleep, food, and diet, or food and activity are important parts, but that social connectedness and positive psychology is the thing that really helps to bring everything together, bring all the positive effects together. And there are multiple aspects within that have actually been shown to add multiple years to your life.
Awesome. Well, thank you again. And thanks everyone for joining us. Our next walk is going to be in 2 weeks. And we've got great walks lined up all the way through the end of April as of now. But a lot of really great topics. So thanks again for joining us. Thanks for getting out and being active and getting your steps in on this Saturday morning. We hope to see you again soon. Don't forget to tell us who you are and where you're walking from in the chat and fill out our survey. So goodbye, everybody. Bye, Dr. Neal. Bye, Dr. Phillips.
Have a great day.